certainly with the consultations on the SDGs, bringing in partners and allies within other regions. And so we've held a dialogue with WHO, but also with GLoabl Health Council, with Just Right, and various civil society alliances, constituencies linked to global initiatives such as Global Fund, War County, and IHP. And so when we have held those consultations, there has been an assumption. Our assumption has always been that we know that UHC is a complex issue. We know that UHC there is no one size fits all. It needs to be shaped at the national level. But the assumption has been that you will have a stronger health and more equitable health when civil society is involved. I think that has been throughout, next slide please, throughout the advocacy that we've pushed through with our guideline. And so we have, I think with many of you present here today and joining in, really pushed for a strong civil society voice within mechanisms that will track how UHC should look like, and also to push for stronger equity elements within both monitoring and accountability. On monitoring and accountability in particular, we held a number of consultations to get input on what works well and what will be elements that we want to forward. And what I want to share is that apart from the obvious, which is there is a need to not only create political space and public space for civil society to take on the role, and there needs to be financial support and more support. We need to make sure that when we speak about civil society, that we address not just the NGOs, international NGOs, but that we also include community-based organizations, media, members of parliament, amongst others. So when we heard that UHC will be part of the SDGs, and that was the case at the UNGA, we wanted to continue to advocate and to influence how it will be translated, how it will be implemented. And together with a number of organizations hosted by Rockefeller Foundation at the time at the UNGA of 2015, a reflection started on what type of accountability could or should be shaped around universal health coverage. And so I'm quite pleased to have with us Lara Brearley, who has been involved in those discussions for many years in the previous life as part of Save the Children. I think in many ways been very closely linked to those consultation processes, and a privileged position as the author of a consultation paper, an options paper on what that UHC accountability could look like. And when we, as GLoabl Health, knew that there was a support for an IHP to become and might transition to that UHC Alliance, we felt it was the right time to try to bring in as many colleagues as possible and to bring in a strong society voice on how that should be achieved. So that is what we're here together today, to be informed about where are we today, and secondly, to start a dialogue, but also to start to collect input, and I hope it's a start of a longer process, to get input from society point of view of what we think should be shaped at a global level. So, next slide, please. So, as I briefly introduced, I would like to invite our first speaker, Lara, to give a brief introduction of the process, a bit of a history, a bit of a background of what is that we're talking about today, and if you can also touch upon who do you see as the main supporters of the idea of a UHC Alliance, and within it, the role for society.
Thanks so much, Tim. And you've said a lot, so I'll try and be brief and not duplicate comments made so far. As you indicated, I've been working as a consultant with management sciences for health on a grant that was supported by the Rockefeller Foundation over the course of much of the last year to try and strengthen originally around monitoring for UHC, and we felt that we needed to build on and complement existing initiatives underway, particularly those led by WHO and the Bank on the monitoring framework for UHC, and found through an informal process of consultation last summer that where we could add value as a society would be more on the multi-stakeholder broader accountability agenda for the UHC in the context of the SDGs, and anticipation that it would indeed be secured as one of the target areas in the health goal, which it was. And so we work very closely. We took a very partner-centric approach to this, obviously being one NGO isn't going to be a way to form the opinion, but to try and shepherd a process with key partners from different constituencies through a dialogue on what does this really mean and look like. We didn't have a hidden agenda, we weren't sure what the outcome would be, so it's been quite an organic evolution over the last 6 to 12 months. So following the kind of informal conversations we were having last summer, there was clearly some difference in opinion and some momentum on the need for something to add to just the monitoring framework for the SDG UHC focus. What would that look like? So we hosted this brainstorming meeting during the General Assembly, as you mentioned, at the Rockefeller Foundation's offices, in partnership with sort of a range of partners, including civil society and also the governments of Japan and USAID and others, the World Bank, WHO. And the idea was to really have a genuine brainstorm, to say, okay, amongst the sort of smallish but useful group of stakeholders, what do we really think this means, and what do we need to think about? What do we want, what do we not want? Do we know any of these parameters? And a lot was shared and expressed and said. There wasn't anything very decisive as such, but during that conversation, there was sort of a toing and froing between specific activities to advance accountability mechanisms. And when I use accountability, we've been using the framework that the Commission on Information Accountability has used within the women and children's health space, which is for the functions of monitor, review, and act. It's a cyclical series of functions. But so there was some discussion on specific initiatives like scorecards, like different tools and processes, to also talking about governance and structures and architectures. And at the time, around the UNGA, those conversations were somewhat conflated. But whilst we were there was one of the participants said, well, do we need better global coordination on the agenda of universal health coverage and health systems in light of the wider SDG health agenda and its breadth across more than just the SDG focus of diseases in specific populations? And so the idea of some sort of an alliance was initiated in that discussion and was sort of taken forward by a range of stakeholders in different channels. It came back up as one of the outcomes from our brainstorming meeting was there was an agreement that a next step would be to draft some sort of an options paper, and it was up to us to sort of drive that process at MSH, but very much with whoever wanted to be involved. So we had a group of partners very closely involved in that drafting process that was self-selected by their own interest. And in that, again, the question of specific approaches to accountability and then also the architecture kept coming up. And a very useful reflection from one of our core partners was that these are very different agendas and they require very different processes, stakeholder engagement and so on. and decisions about some of these issues will be taken in different ways. So perhaps it would make more sense to separate out these agendas of the specific options for accountability and the architecture for global health system strengthening and UHC coordination, with potentially a focus on accountability within that. At that point, it was discussed at the IHP steering committee meeting in November, I believe, and agreed that the core team of the IHP would move forward in trying to draft a paper on this UHC 2030 Alliance or partnership. So we then continued to focus more specifically on what does to strengthen accountability really entail, and what could this look like? And we worked with these partners to draft an options paper that wasn't perfect or polished, but it was to initiate dialogue, and that was the launch of the 2-month consultation with in-person meetings hosted in various events that were happening, as well as an online public consultation. And to wrap up that work, what we just launched is a summary synthesis report of that consultation. So gathering the inputs that were from at least 100 different individuals from a range of constituencies and types. Analyze those inputs and provide something that would help think looking forwards on what we want to be doing on accountability and what could one be thinking about. So I'm not going to talk at length about that report. It would be great if people take a look at it, and hopefully some of the key messages that came out of that report will help to inform the discussion moving forwards. But certainly there was a sense of the importance, the urgency and timeliness of thinking about accountability, and thinking about accountability in a more integrated way on health and even beyond health in the SDGs than has been done so to date. There was also a strong sense, and a lot of inputs emphasise the importance of building on things that exist rather than just proliferating and adding to our already quite complicated global health space. And so one of the recommendations we had put in our options paper was that the IHP Plus consider adaptation to a wider UHC Alliance, and that is, you'll hear more about that from Marjolaine. And a key component of that being better coordinated and organised civil society activities around this agenda. And that should somehow fit within this architecture for UHC, but also have space to provide an independent voice and hold other stakeholders to account and so on. So again, as Tim mentioned, Bruno and colleagues have been working on thinking that through and helping to accelerate dialogue on that agenda. So in our synthesis report, we came up with a few recommendations. These remain quite broad, but we hope that they will be taken forward, and we've been lobbying stakeholders to ensure that they are. But certainly it was felt that the mandate of the UHC 2030, or whatever it evolves to be called, should certainly have a clear focus on accountability. That there is a need for accountability to be strengthened at all levels, and this includes an important function at the global level, but also facilitating functions through global dynamics at country and regional levels. And we felt that there was certainly an added value that a multi-stakeholder and potentially multi-sectoral global alliance could bring to the issue of accountability in various ways. Another thing, message that came through loud and clear was that accountability needs to be resourced. It's not going to just happen by itself. It needs capacities and it needs funds to be able to implement. And these sort of messages that we hope won't get lost as the alliance takes more form. So these are some of the big messages that came through, but as I said, I won't go into them in too much depth, but I hope they're a useful contribution to some of this thinking moving forward. Thank you.
Thank you, Lara. And so the report itself can be found online on our website. It's also available on the website of National Sciences for Health. And I do recommend you to go and read through them. We'll come back for clarification questions after the presentations for colleagues to ask questions and then have a debate. So I'd like to now hand over to Marjolaine Nicod as new IHP coordinator. Thank you once again for joining us and the importance that you attach to civil society input, and so we'll make sure that we have time for debate and questions. If you could give us an update on how the IHP transition is foreseen. I think we all, as a society, have been supportive of the principles of IHP to be guiding the post-delivery and SDG process. But so it would be helpful if you can to also touch on some of the lessons learned of how IHP functions and how you see it taking forward.
Okay, good afternoon to everyone. To start with, some fresh news, some exciting news from last week, when 66 IHP plus signatories agreed unanimously to transform IHP plus to global health mandate and adapt to the 2030 Sustainable Development Agenda. So the transformation process is now becoming real. It's been spearheaded by the initiatives from the government of Germany and Japan for better coordination around system strengthening at UHC during the UN General Assembly special session on the SDGs last year in New York. In the meantime, the IHP Plus has been, the steering committee of the IHP Plus has been discussing how to take this kind of political momentum forward. And there has been various discussion and consultation, which received a lot of support. I mean, developing countries are quite supportive. Obviously, CSOs have been discussing in many different ways, and obviously the fact that CSOs are also looking at how to establish a CSO engagement mechanisms is a good sign that this is the right way to go. At the same time, there was also some kind of a call to build on something which exists already rather than starting from scratch and creating a new body. So that's why there was this idea of transforming IHP Plus, and of course now there is a broad consensus to do that. But of course the next step is to see how this will actually take place in practice. First, in terms of aligning IHP Plus with the global aid architecture and establish this new partnership, which would be framed around UHC 2030. The name, the exact name still has to be decided. The next slide. Basically, the aim would be to create a movement for accelerated, equitable, and sustainable progress towards UHC, as well as the other health targets in the SDGs, including global public health security and equity. The objective of UHC 2030 are seen as being fourfold. First, it would be to provide a platform to coordinate health system strengthening efforts, including synergies with related networks and partnership, and we know that there are quite a few. The second objective would be to consolidate the political momentum around a shared global vision of UHC and advocate for sufficient resource allocation, coordinated resources towards health systems and UHC. Thirdly, it would facilitate accountability for progress towards UHC and SDG 3. And last but not least, in countries receiving external assistance, we've heard quite loudly the message that it's important to continue to promote coordination and alignment behind one national strategy, one budget to try to avoid the fragmentation of efforts and resources. Next slide, please. So in terms of structure, as I said, I mean, the idea is to build on IHP rather than create something from scratch. So there would be a process where we would need to adjust the IHP global compact to reflect the focus from health systems towards UHC and including equity and health security. We will need to see how to expand membership to include a broader range of countries and in terms of non-state actors, including civil society, as this is already the case in IHP+, but also other stakeholders. So for that we will need to reconfigure the steering committee. In terms of creating a platform where various initiatives and partnerships could come together to create more synergies and exchange lessons learned and avoid some of the existing duplication of efforts and fragmentation. Obviously, we need to find ways to make this happen, and one way would be also to start looking at how to strengthen knowledge management and see how coordination and exchange can happen on some of these relevant initiatives. And the CSO engagement mechanism under UHC 2030 would be very much part of this, and it would be a good vehicle to support capacity strengthening and advocacy for coordination on health systems and UHC CSOs, both at the global level and at the country level. In terms of building on IHP+, I mean, it's important to remember that basically IHP Plus has been quite good in many ways as in terms of providing a multi-stakeholder platform which includes national governments, development partners, civil society organizations. It's been quite good at promoting country leadership and alignment behind one single health strategy and one budget. It's been also playing an instrumental role in institutionalizing good practice and establishing some norms and principles. The strength of IHP Plus is very often seen also as having this strong country focus, providing practical tools to support alignment and joint approaches for planning, management and monitoring. And well, one can argue that so far it's been the only international initiative working across specific health issues and intervention. This being said, I mean, of course, IHP Plus can do a lot better, and it needs to be more inclusive. I mean, so far it was basically focusing, because of the mandate around effective development cooperation, obviously countries, including mainly low-income countries and some middle-income countries from the lower parts. But obviously with the SDGs being relevant for everyone and rich and poor countries, obviously it would be interesting to raise the interest of middle-income countries, because there's also a lot more to be learned from them, but also they are facing issues, and even rich countries will have to figure out how to be accountable for making progress towards UHC. I think IHP Plus was good in opening up to civil society organizations, but I think at the country level, the engagement of non-state actors needs to be meaningful. it's not just inviting CSOs at the table, it's to make sure that there is a clear understanding of on what's the purpose of having that and what are the mechanisms to ensure this clear contribution to the discussion on planning, implementation, and tracking of progress. Then, of course, things are changing in countries, even in low-income countries. I mean, most of the resources for health are being mobilized domestically. So, obviously, we really need to look into that. And as part of this, to rethink the strategic role of development cooperation, and what's what kind of focus should it be, and also what kind of modalities should be used. And of course, the last point is to anchor some of the processes of our IHP plus on results, for example, and accountability more in country processes rather than having a separate platform and adding to the multiple reporting requirements. So with the SDGs, it's an additional layer potentially. So I think we have enough food for thought and a lot to build upon. So just to summarize, what UHC 2030 could do or would do is one, provide a platform for more effective health system strengthening and multi-sector engagement. Two, establish principles for coordination on UHC with targets for partners to meet. Three, monitor progress, announce accountability and maintain momentum. And fourth, promote knowledge sharing. What UHC 2030 would not do and should not do is not like IHP Plus. I mean, UHC 2030 is not being seen as becoming a founding body. Its role is really to advocate for more and better coordinated and aligned resources for health system strengthening. And secondly, the Secretariat of UHC 2030 would not become a technical assistance agency, but would continue to advocate and facilitate better coordination and aligned technical advice, and maybe develop some tools that can be used, but it's not to substitute for what different partners have to do themselves.
Next slide, please.
So, well, I think that was the end because my presentation was cut. But yeah, as I said, I think we have a lot to build upon. In terms of next steps, I think there is broad agreement that that's the right way to go. We hope that at the June meeting of the Steering Committee of IHP Plus, there will be an agreement on the name of this new partnership or alliance. And there will be also an agreement on the new steering committee in terms of how it should look like. And then the day after, we would organize multi-stakeholder consultation on the strategy and activities that could be developed on the UHC 2030. This would mark the launch of the transformation of IHP Plus. And obviously it's important to bring stakeholders who've been involved in the process, but also mobilize stakeholders who've not been involved in the process so far, so that we can get a broader range of views of what would be useful and meaningful. And then we hope that we will be able to announce the setting up of this new IHP Plus or UHC 2030 during the UN General Assembly in New York, and by the end of the year, having the new steering committee in place, we could make some further progress on some of the governance arrangements, including the Global Compact for adhering to UHC 2030, and have like also a work plan and list of things that would then move IHP Plus in a new mode of functioning. So this is very much, because we are talking about transformation, this is an iterative process and we will learn as we go. Last year, many questions, but obviously we all have questions and we will in due course, one by one, and maybe it's better to start small and build on that and try to achieve everything perfectly from the beginning. But of course, we need to also be mindful of some pitfalls and avoid creating wrong expectations and then taking this new partnership in the wrong direction.
Thank you, and I'll make sure that we add that slide with those key dates because that is really going to determine much of what we are going to talk about, and certainly how we can position ourselves and what window of opportunity we have. So just to quickly recap, you mentioned there's a steering committee, IHP steering committee meeting on the 21st of June, which is tomorrow, so to speak, as a first landmark. Then a launch at the UNGA in September, and then a process of further implementing with the ambition of actually starting in 2017. I think that's correct.
Maybe I should add that we have a concept note for the transformation of IHP Plus, and we have prepared a revised note on the basis of previous discussion, and the consultation is still ongoing within the steering committee meeting until, well, actually almost the end of this week. And obviously CSOs are welcome to contribute, and we have two of your representatives on board, so hopefully conference this week, and it's on the website, so we also welcome this from whoever is interested to contribute to the process.
Excellent. We will take advantage of that. For benefit of time, I will skip through the presentation by colleague Bruno Nicod as the IHP Plus Society representative. But just to indicate, so that a consultation within IHP Plus Society constituency is happening with, next slide please, we've already inputted some learning from how IHP Plus was shaped and how it managed to link country level advocacy, capacity building society to global processes. Next slide please. But what we really want to take advantage of today is to hear your questions from those that are present here physically and those that joined online. And I propose to do it in two sections, if you allow me. One, if there are questions for clarification that you might have on what was presented, on the larger background and process that was described by Lara, or on IHP and the transition plans. So first, questions for clarification, and then we'll tackle proper debate on one of the few big questions that we know that exist, that we have. And we'll make sure that we end at 4:30 with a number of next steps, having in mind the timeline that we just heard, and trying to get input through colleagues of IHP Plus, but if we can more broadly as such, because this transition is really vital for everything. So without further ado, I'd like to invite colleagues present here with us first. There's a burning question of the forward. And meanwhile, those joining online can either write questions in chat or raise their hands virtually that they want to speak. So, colleagues, are there any questions or clarifications? Can you please introduce yourself before you speak?
Thank you. It's Ariel Sancho from CMMP Peru and the steering committee of COPASA. Just to highlight the need of sharing all of us comprehensive definition of universal health coverage. I mean this because sometimes, as it has been said in one of the papers that we have received, our governments get a little confusion between universal health coverage and universal health insurance. Universal health insurance could be a very important step, but being affiliated doesn't ensure that you have access to good quality services, and also could let out some of the public health issues that you have raised in the previous definition. So this is one, we need to share that. I know there's a very big accent on the financial issue, but we cannot let the other words out of the definition. And just to welcome the idea of working with middle-income countries, because having more money in the country not necessarily guarantees more internal democracy when we come to governance, accountability, and all these approaches and principles that are needed for the government being accountable to their society. You know? So not only that, there's this phenomenon that we have advanced in national indicators. We have problems with inequalities, deep inequalities in middle-income countries. And whatever the weather, the solutions that we could find for universal health coverage in middle-income countries, for not letting anybody behind, will be probably the solutions or the initiatives that we should put in place in the future. In some countries, emerging economies of Africa, Asia, that are going to be facing probably the same problem that we are facing. So working with middle-income countries is justified for me, from my point of view, not only because we are addressing particular inequality problems, but also because it's somehow the future of many of the countries that are now not in that condition.
Thank you. So a question for clarification and a statement in support of middle-income countries, lessons learned useful for most other countries. But so the question about how can we ensure that the definition of UHC is the one that we've been pushing for and need still to push for, as we have statements here at the World Health Assembly calling for household consolidation to be measured as a financial measure. So I'll put a question to you, but I just want to go round the first one and see if there's another question for clarification, please, first, and then we
Yeah, I'm Lara from Oxfam, Germany. I would like to ask you if you could elaborate a bit further on how the German roadmap initiative is actually linked to the UHC Alliance initiative. From what you said, I understand that it was mainly Germany who pushed for the UHC Alliance. That's what I understand right now. On the other hand, from our colleagues in Germany, we know that the expectation is that the roadmap will be taken over by the UHC Alliance at some point at the end of this year, probably. So it seems to be two parallel processes, but at the end they are very much linked to each other. So it would be wonderful if you could give some more information on how these processes are working together. And can I ask another question? And my second question is, you mentioned that, like, one of the lessons learned probably from IHP Plus was that maybe at country level the civil society involvement was not meaningful enough. That's what at least what I understand from what you said. And I wonder, how can we ensure, or how can it be ensured that in the UHC Alliance civil society involvement will be more meaningful? Thank you.
Okay, thank you. I will invite Marjolaine Nicod to respond to those two questions. So how the German roadmap on necessary anti-lives is linked, or how would it be incorporated or not within the UHC Alliance? And the first question was around the understanding and definition of UHC. Yes.
Just a first point of clarification, I think the kind of strong political drive last year at Geneva came from both the governments of Germany and Japan, and actually it's been quite a fortunate process because Japan is having the presidency of G7 this year, so I think they've been working really hard with other partners, including Germany, but of course all the G7 members, to keep this on the agenda. And the G7 summit is actually taking place this week in Japan, and we will see hopefully a reference to UHC and UHC partnership. Let's see how it will come up. The news will be available later this year. The roadmap promoted by Germany is part of these global political processes, which are always useful to keep the momentum and stimulate thinking and keep things high on the agenda. I understand that in terms of implementation, discussions are still going on, and obviously this is also something to look at in more detail later this year. But obviously the fact that Germany was working on this roadmap, and at the same time you had the discussion within IHP Plus, and of course, you know, there is like natural convergence, so I don't think it's either or. I think it will be quite natural that things are interlinked and mutually reinforcing. Regarding the definition of the UHC, I think the point you mentioned is very well recognized, and hopefully in some of the papers used to support consultation, it's not conveying this message that we are taking a narrow focus on UHC. On the contrary, I think the important, I mean, and especially with Ebola, maybe there has been recognition that we need to build strong health systems to make them resilient to epidemics, crisis, and I think that in the movement around establishing UHC 2030, I think it's very well recognized that it's not just a question of having the resources, it's also ensuring that we have the right policies to ensure equity and quality of services, and then also build this resilience, which is very much necessary. And I think the focus on equity and security is part of the overall aim. In terms of CSO engagement, well, I would like to hear from you how we can make engagement at country level more meaningful. Obviously, when I was saying CSOs was not always meaningful or positive among countries, and I'm sure there are countries where we've heard also very good examples this morning where CSOs have made quite a big impact in terms of transforming the agenda in their own countries. So we can certainly learn from these success stories. Then, from the point of view of UHC 2030, I mean, the platform cannot be held responsible for making this happen. It can stimulate the discussion, bring to the light the great examples, but at the end of the day, it's the individual responsibility of everyone to make this happen. And of course, dynamics are different depending on the countries. In some countries, we know that the space for civil society is shrinking, so it's not always easy. But I understand also that if you focus on more concrete agenda, less political, maybe things can still happen. You know, keep the spirit of having a CSO voice accountability. So, but I would like to hear from you in terms of how we can make that. Obviously, the idea also of providing more space in the alliance with this CSO engagement mechanism would be also part of trying to facilitate a way forward.
Thank you. So I'd like to open the floor to you, but ask not only questions to Brearley, but also your input and reflection that you have on, I think, two things that we need to reflect on. One is our, and these are just first initial reflections, we'll make sure that we have the process on the alliance itself, what it stands for. And then the second question that we need to think of is how do we respond to the architecture that's being suggested, and how are we going to respond and try to squeeze ourselves in or not. And so there's a more process-oriented question and a more general, almost political question about how we see the UHC Alliance. And to just throw on the floor for you to reflect is that we know that UHC by nature, by definition, is political. It's about making political choices. And to make it even more complex, we are in an SDG context where universality will shift the accountability agenda, which was used to be part of IHP, which was more a development countries versus donors. The universality within the SDGs should push us to put duty bearers accountable to citizens. So it should be another type of dynamic that we check. So if you combine those two, the universality and the political nature of UHC, I'd like you to reflect and share comments and reflections on what is being suggested as the UHC Alliance. The floor is yours.
Thomas from Medicus from the International Network. First about the topic, I'm not so much worried about having UHC defined too narrow but too broadly. I think we have to take care that this UHC enthusiasm does not lead us to seeing UHC as the overall key for achieving health to all. I think it's the health sector contribution to achieving health for all, or it can be one of the health sector contributions and responsibilities. A part of this, I think, health for all has to be achieved through many other actions in other sections also, regarding determinants of health, regarding policies in other sections. So this is also what I would say, that we have to take care that we don't verticalize UHC in a way that we promote it too strongly and think that if we have resolved this issue, then the whole thing is done. It's far from this. Secondly, on the architecture and on the alliance, I think it's a thrilling moment as it is in the making, and we have seen other partnerships and alliances being built also and struggling with the governance and the accountability structures within. I think this is where we will have a close look at as our organizations, because this is our main worries with new partnerships. It's with their governance, how are they built and how do they deal with the constituencies, with the interests, harmonizing where possible, but also being clear and being transparent on positions and on processes. I think we can easily agree on goals, and we are much more struggling when we have to agree on how to achieve them. And in universal health coverage, I think we have seen many actors pretending that what they do will contribute to achieving universal health coverage, and we doubt. So I think this needs a really in-depth dialogue and honesty and reflection also within the alliance and among the actors. And an important step is really to define the overall architecture of the thing and to define also how are the different constituencies' roles in the alliance. What I would not love to see is civil society in a way restricted in a advocacy corner. I think we have much more to contribute than just, in a way, promotional advocacy for the goal of universal health coverage. We also have other responsibilities and other roles. While many of us are involved at a national level in health services delivery, at an international level in health cooperation, and there are also things we have to reflect on our own role of not weakening health systems but strengthening them. And so, in the overall making, I think that the space for civil society and for NGOs should be much broader than what I have seen on the screen in this bubble on advocacy. And I think we have talked about this, and you have talked about this, Nico, and I hear a clear openness also for defining this more broadly. Thank you.
Thank you, Thomas, for those reflections. Before we come back to any other reflections or any questions we have, I'd like to invite colleagues that we have from Kenya, kind of African Union Society, who colleagues might be here, to share reflections on how you see the potential of or dangers of the UHC Alliance when it comes to what you are already doing or what you would like to see at a national level. I'm asking this because I did participate at a consultation that Lara and the Foundation held in January in Bangkok, and where there was an audience that was mainly constituted of organizations and colleagues from the regions, and so they were less interested about what's being shaped at a global level, but were quite not concerned, but wanted to learn more about what it would add for them at the national level, how it would add their multi-stakeholder platform, narrow within multi-stakeholder. So if you have any reflections or perspectives to share about what's being.
Well, I agree. Accountability, the civil society role should could be narrow if we have a narrow understanding of universal health coverage. No, that's why I welcome when one of the slides was mentioning that it addresses public health in general. No, and also it could open the option for sectors to cooperate between themselves. However, I would like to raise one of the things that Lara mentioned, that accountability and general governance mechanisms need to be resourced. As she says, it happens with much effort from civil society organizations, both international, national, and grassroots organizations. But even the process of building capacities, for example, in Quechua women, rural Quechua women, and facilitating that they could gather to analyze what they have found in their citizen monitoring or other mechanisms, community scorecards, etc., need some resources. And those resources, historically, the governments have never considered are part of the role. No? Different to Brazil, which is the only example that I have. Government has never considered the structuring of governance mechanisms in different levels of the country for dialogue, analysis, and accountability, part of the task. And I think if this UHC Alliance could address this properly, then it's going to open some venues for action, more effective action, inside the countries. No? Problem is that whenever we have addressed agencies, isolated agencies by themselves, most of them are a little afraid of just challenging the government on this. So if the UHC Alliance could have a specific work together with the civil society organizations on how to address this, that would be fantastic.
Thank you. Emmanuel, I know that Emmanuel and Tim, that you also work on budget tracking amongst many other things, and we've heard previous work that already been done pushing for one health plan and one health budget. We also see that the ODA goes flat or even declines, and so there's a lot more emphasis on domestic resources. So again, there will be the GLoabl Alliance, but the decisions and the resources will be taken at a national level. So how do you see the advantage or the added value of the UHC Alliance? What do you think?
Well, thank you very much, Tim. I think, first of all, the concept of the UHC itself and how African governments finance it hasn't been really well thought through by even implementing countries. Because the cost of actually implementing UHC will be a big challenge. We've seen from data that countries like Togo, for example, probably need the entire national budget dedicated to health, right, to meet UHC obligations. I think the benefit of the UHC Alliance speaks to the opportunity it has for stakeholders and partners to, first of all, be able to coordinate efforts and understand the resource requirements needed. But also, it will help with a better picture to see where the gaps are, where better efficient use of resources will be. And I think for civil society advocacy work, it took us a while to get on the UHC table of engagement, but it's becoming more clearer, and I think that it's showing the value added in terms of where we need to put more effort around managing the resources, or where more needs to go in terms of how it's organized.
Thank you. Again, do you want to reflect, and Lara, on these more general reflection that we heard, and then I'd like to do a short second round that will look more particularly on the architecture and governance, which topics was raised, but more on the general reflections of UHC Alliance. For what you've heard, a few questions and reflections, is there anything that you would like to respond to or reflect on yourself?
Hi, thanks very much, and really interesting contributions. I think one of the things that comes to my mind, where I struggle in my own mind with the balance and the tensions between a focus on a global initiative versus really focusing on country level, particularly, where really the emphasis needs to be, because that's where lives will change and where policies matter most, I would say. And so what catalytic role, we need to be quite, I think, proactive in challenging ourselves. So what is the added value of the global architecture around accelerating progress at country level? And I think there are some, and we know that there are some. And that people have mentioned some of the global added values, like coordinated development systems, and some of the experiences of IHP Plus today, developing tools, facilitating peer exchange, documenting and learning, capacity strengthening in a way that perhaps has greater efficiencies and benefits than just if it was focused on isolated and country-specific efforts. So there are certainly some added values, but where does it really catalyse action at country level and how? And I think we need to look to other initiatives within the health sector, but also beyond, as to what opportunities, what experiences and best practices have there been, and what hasn't worked for trying to accelerate some of these efforts like accountability, which has to happen at different levels. I think there's a lot of interesting experience. Everybody's learning by doing to some extent, it's my sense, on accountability in the context of the SDGs. We're not sure what that official reporting requirements and structures will look like, but they're being formed, and so we will need to find ways to service those official SDG mechanisms whilst also strengthening domestic dialogues, especially, but also the opportunities at regional and other levels. Something that, I mean, a recommendation that I think is has a global implication that came out in our work was the the importance of independent accountability. You have lots of different forms of accountability, and I think, as Tim, you mentioned, one of the most important to focus on is the relationship between citizen and state. At the same time, there's mutual accountability, multipolar accountability models that need to be explored. But there is also the role of independent accountability. The experience that we've seen in some health spaces, so every woman, every child, maternal newborn child health, but also in polio and others, is that independent accountability matters. And the Secretary General has appointed an independent panel that focuses on every woman, every child, the second of such sort of initiative. And is that appropriate for the context of the SDGs? Do we want to see a proliferation of Secretary General appointed panels? I don't think we really do. And where can we leverage that existing panel to service the wider SDG3 agenda? How do we ensure balance across the different interest areas and needs within that space? I mean, one thing is within the sector, another lens is across the goals, and I think that came out in Thomas's point on his concern about this being seen as the be-all and end-all for achieving good health. Of course it's not. We all know, and I think we would agree, that the goals as a whole, only by having an integrated approach to cross-sectoral approach will we realise these opportunities in the context of the SDGs. But what does that mean in practice? How do we focus that? How do we operationalise some of these intersectoral opportunities? I don't think we really have a lot of answers, but I think it's useful to keep asking those questions and looking elsewhere to see if we can learn and improve the opportunities.
Thank you. Marjolaine, any reflections you'd like to have on the need to actually transition from an efficiency focus to more capitalist and the shift towards accountability that also addresses citizens' concerns towards their areas, and whatever what you've heard?
Well, the feedback from countries regarding the contribution of IHP Plus, for example, include that it's been a useful input into multi-stakeholder policy dialogue at country level, and a contribution to enhance the profile and quality of performance monitoring. So it shows that having some kind of, I think that the focus needs to remain as, trying to support country level efforts. And the experience to date with IHP Plus, but maybe also other initiatives, shows that if you have like a global process, it provides a useful reference point, and it's also it can also empower different stakeholders to keep various actors accountable for delivering on what they are supposed to deliver. For example, in the case of IHP Plus, obviously, governments in developing countries were able to use this as, to at least they had a referential for what's good practice and what they can expect in terms of behavior from the developing partners. It doesn't mean that behavior change has happened dramatically, but at least there was a useful benchmark point. And for CSOs, obviously, it's also extremely important because you have also a kind of set of commitments to hold governments accountable for. When it comes to the too broad focus on UHC, well, I think the focus of UHC 2030 would remain on health system strengthening, because obviously UHC is a lot broader. So it's not focusing narrowly on financing aspects, but with the focus on health system strengthening, I think we can look into the policy institutions and resources aspects of it, but keeping this focus will provide a useful guide and avoid being all over the place. And regarding the role of those CSOs, I think, again, maybe this diagram is a little bit simplistic, and it's always the case when you try to put it. Obviously, the point was not to corner civil society into an advocacy role, but here probably it's showing at the global level how you bring different initiatives into a kind of convenient platform that obviously the kind of country level dimension is missing, and it's where obviously CSOs have a role in terms of being part of the planning, implementation and monitoring process. And, I will try to see how we can improve this from, at least to reflect that, for example, the steering committee meeting will be of multi-stakeholder nature, and I mean, maybe we need a little more, I don't know. Thanks for pointing this out, because yeah, I can see the limitation.
Can I ask a follow-up question on and this brings us to the governance, governance and also and representation of the society within that governance. Yes, if there are questions so far, so we do invite colleagues that are online to think out any further questions to ask. So to come back, so on governance, we looked at existing various mechanisms where, and the role of society within those, where the global fund model is a stronger institutionalization, if you allow me, of civil society variants into other mechanisms where it's more on a voluntary basis, in the same way where the reporting by members is more on a voluntary basis versus another mechanisms that is mandatory reporting. So could you share some what is being conceived, although it's still in the process, but how strong the governance is being conceived and particularly in the role of civil society?
Do you want me to answer the question right now, or do you want to take other questions at the same time?
It's probably helpful if you could share what you know, and then I'll ask for comments and reflections by colleagues. Yes.
Well, the discussion on governance has not gone too far in terms of the detail. And I think the first or the starting point would be to appoint a new steering committee that would be more representative of a broadened membership. And then when the steering committee is in place, and then there will be room for discussing all kinds of other aspects, because obviously you don't want the old structure to preempt too much what the new structure would, how it would function. So I think in June we will submit to a steering committee some of the basic principles, so that we can, continue or so that we can start the process of transformation. And obviously, there will be also room for reviewing how this will after a couple of years and see. Because obviously, I think as part of the SDG follow-up process, there are still many things being up in the air, and obviously, maybe not too many people on a wait and see, or hoping that the neighbors will find the. I mean, we are venturing into new grounds, but I think if we manage our, we need to have a good enough level of ambition in terms of where we want to go, in terms of aspiration, and in terms of how we implement this. We could have a series of milestones, and as part of the revised concept note that will be submitted to the steering committee in June, we have a section which is for the time being still empty, because the within the core team, we couldn't really fully agree on how we would present this. We included a section on success criteria. So how would the success for UHC 2030 look like? Obviously, you need the kind of long-term, aspirational level, but you need also a series of intermediate milestones in terms of, tomorrow, the day after tomorrow, maybe. I think this is a kind of organic process, so you need also to keep some flexibility. Although this morning I had, after the meeting, I had an interesting discussion with the representative from the medical community, Mr. Schwartz, on how at the same time, I mean, this is fine, but at the same time we still need some guiding principles, because you need to be, you want to, to be transparent and about how you go about this and why you selected this approach. In this partnership world, we are functioning under very loose processes, and the rules of the games are no longer that clear, and you can't say, okay, this is right, this is wrong. So you need to, it's always important to have like a kind of strong line of principles, and then maybe under this you can figure out also what can work, and maybe things will need to be adjusted as we go.
Thank you. So I understand that there's still...
Sorry, we will definitely also take stock of different models and build on, and obviously the paper that Lara has been working on is very useful and kind with suggestions.
Excellent. That was what I was about to say. So it's great. It's great to hear that it is still being discussed, being reflected upon. So we'll take it upon us to share principles and red lines, what we see as really valuable and important for a civil society when it comes to governance. And it will vary, I think, according to each one's experience. But we have, there's some elements that are captured within the notes that was drafted, and you mentioned one, which is the need for independent accountability. And so this will bring us to what are next steps, because I think I'm happy to hear any of the thoughts or key principles that you want to share right now. But it occurs to me that we would need a bit of a process to be able to capture what we already know are principles and red lines, and also to try to still shape them as much as possible and react or shape upon what's being put on the table. But the element of independent accountability that you mentioned, I really think that perhaps it's useful to think as a society about our role both within and outside the UHC Alliance, and perhaps we should reflect on how we both want to define our role within as a society partner within the multi-stakeholder partnership, but at the same time, and this is relevant, so that the global will also be mentioned at the national level, there is a need to have an independent voice, and there's a need to be able to have independent accountability, preferably by citizens, not just individuals, and including reflecting on ourselves, as was mentioned before. However, that will ideally, if that is acknowledged, it would require a different type of support by both the country level, and if the country level is not willing or able to do it, by a regional or global level. Any
Yeah, I said, did you mention the work done by the IHP Plus civil society group, representative of the CSO? IHP that has already proposed some structures to be debated and to be actually shared globally. This is just for the how the CSOs could work inside the IHP, which it's not on the IHP itself, I mean on this UHC Alliance structure itself. I think it's important also to mention that some work has been done from the representative of the IHP CSOs that are already thinking about that. And it's probably a second step, but it's important to say that we're not starting from scratch neither from the IHP CSO group, but there's already something built, I mean, drafts that could be shared and then consulted with others to give their inputs on it. I think it's important to mention at least.
Yes, absolutely. Thank you to remind me, Annick. And if we can go up one slide, then go up in the other direction. So on the slide with Bruno's references, I added the link to not just the IHP Society constituency to give an idea of how it's constituted, but also the version of what you referred to, which is the concept note, or what is the society perspective on the concept note, and a number of mechanisms. So what could be governance, society engagement within the government is being discussed. So that would be a good basis to start, as well as tools and reflections that you might have yourself. So this brings us to, if there's no other final comments or reflections, there is. Go ahead, and then we go to the next level.
Just to be very explicit, I think this governance dialogue, this is important for us, and as I see the civil society approach is also still in the making. Who is in a way coordinating this process, to whom to refer if you have input to provide this. Is this Bruno, is this you, or how? Is this already organized, or how do you think that this will be organized between now and the really hot period where decisions are being taken on this civil society engagement mechanism?
Thank you so much for the question. That is the question now for the next step. So it's so actual GLoabl Health role until now was simply to convene and allow for an update for a broader group than those that are within IHP. Within IHP, as you, so society constituency, as you know, there is difference, or there's a dual job of a northern and southern representative. Northern representative Lara and southern representative Rosina. We apologize, Rosina, to get your last name. Thank you, Mr. So both of them are engaged in collecting, as far as understood, inputs from society related to IHP. How to take it forward is what we need to agree amongst ourselves. And so I think this is a first attempt to make it a bit more known and to broaden it beyond a few people or organizations that are already. And so I'm happy to either now or in the coming days hear about what are existing moments that exist that we can take advantage of. We're also having reflecting with support from IHP. So, on what supports could there be from the IHP Secretariat in helping bring this together, in helping an input. And so this brings us to, so the answer is not clear, but it will be clarified in the coming days. Currently, Bruno and Rosina are clearly leading the process. That are asking other networks, such as ours, yours, to help and engage with all the constituency. There is a question of timing, where we need to perhaps, that's something that we need to discuss, distinguish what is it that we want to input by when. And so first deadline is aim is the upcoming steering committee from IHP on 21st of June, whereby we will be asked to, or by the IHP plus society constituencies asked to provide an inputs. And so ideally we provide inputs, correct me if I'm wrong, I understand well, to what will be discussed at the steering committee. And so the question is, what is it that what do we see feasible to input? Is it at the level of, like the first discussion that we had on how do we see the UHC Alliance and what are key principles or red lines that we really want to push for? And then negotiate with IHP, UHC Alliance, a bit more time in order to help shape more the implementation and the governance part. Where do we see our role and where does our society role fit in? And hoping we can buy some more time to make that consultation. But that's my perspective. I'm happy to hear other reflections or opportunities that you might see.
Can I just comment? As far as I understand, so for the 21st, there is the opportunity to feed into the civil society representatives of the steering committee of IHP, who will be meeting. So that is one channel for input. And that is why I think Rosina and Bruno have been proposing a consultation process. I think it would be really helpful to clarify if there are other direct ways for stakeholders to input into the IHP core team on this, on the evolution of the thinking and whatever is presented for that 21st of July. Is there a window of opportunity for consultation? Or is it through only the sort of science representatives to the 21st of June that channel of influence? So,
We might not have the answer there. We might be answering it.
I think for the first step, steering committee, we hope to, by the 21st of June, say, okay, now we launch the transformation process, so we agreed on the aim, objectives, core functions, and we have a name, and at the same time we will also, in addition to the concept note, which is being under consultation now, we will also prepare a note on some of the governance arrangement in terms of restructuring the steering committee and posing the main headlines for also adjusting the global compact, which we used to have for IHP Plus. So I think for this it would be better if the consultation could happen through the two representatives of IHP Plus in the steering committee. Then when it comes to the broader consultation, as I said earlier, we organized right after the steering committee a two-day multi-stakeholder consultation process where we can have views in a more open way from a broader range of actors, both who have been already involved in the IHP Plus and those who are interested to play a role in the transformation of IHP Plus into UHC 2030. And here, I think it would be useful to have views from a broader region. I think here it can be less structured. We've started to invite a range of people. Of course, it's not an easy call because obviously we want to keep the meeting within 100 people, and we need to ensure balance between people from the past and people from the future. We need a balance between state and non-state. We need a balance between developing countries, low-income countries, middle-income countries, high-income countries. I don't remember all the different parameters. but we can see how we can have maybe something a little bit more open through kind of online process, or let's see if there's interest. And the discussion here will be extremely important to reform the way forward in terms of pinning down the nitty-gritty governance aspect in terms of the functioning of the steering committee and the roles and the responsibilities, and also in terms of how you translate this broad aspiration for UHC 2030 into an actual program of work in terms of activities and deliverables and overall strategy. So I think this is, and the process will still be ongoing until until the time the steering committee meets for the first time towards the end of the year. So I hope this is helping to clarify.
Okay, thank you. We will, on that note, close the session, as I see any final reactions. And so we will take contact back again with the society representatives, Bruno Resina, to look at the process on how can we input on the note that they have drafted, how can we input on their participation from the steering committee. If you could share, it's practical, but if you could share the civil society participants who might be joining the follow-on question, or if we can suggest names that might be perhaps something to consider for the meeting that you referred to. If you know people that we would like to see be present or to have a voice, either through IHP, society representative, or actually being there. And I think we will have to come together either on a call to agree on a process of input for that 21st of June, and then there will be probably have a longer input process for what will follow after the state meeting.
Of course, we need also to take advantage of existing meetings being scheduled in the next few months, because we can't have the entire world in one meeting. So I think we need also to take advantage of things which are already planned. I mean, obviously today was one good example. I'm aware that Bruno last week was in Washington, D.C. because the World Bank had the meeting of the Global Partnership for Social Accountability, and he had a slot in the plenary discussion where we talked about this things, and he organized a meeting on the side for interested organizations. So if you are aware of any meetings, or if you are organizing yourself meetings, I mean, we are happy either the IHP plus CSO representative or members of the core team. We are happy to feed into or to provide you with some background materials. I mean, it's and we can use the webinar and maybe reproduce another webinar. It's too difficult to organize. But I think we need to not to focus just on one single meeting, but also see whether there are other good relevant meetings.
Okay, great. So this is one step of a long process. Final reflection, then we will close the meeting. Please Thomas.
Well, it's not a reflection, it's just a statement. There are people like us who are moving in and out because we don't just have the capacities to follow all those processes all the time in all places. We are so happy that there are a couple of people in organizations who have the capacity of keeping a bit of sustainability and structure, also in civil society involvement. So many thanks to actually for GLoabl Health and others who prepared today's afternoon meeting. Many thanks for those who prepared the morning meetings. I think even if you don't agree at all points and all the times, I think it's just good to have you, and this is very much appreciated.
On that note, thank you very much. Thank you for the speakers and thank you for all the colleagues that joined online. As I said, this will be posted also on our website and shared. Thank you.